Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes once again. Today, we will talk about the speaking task. And as always, I would like to request you to subscribe our channel if you have not by the name of Dr. BKM OET Institutes. And please share it with your friends, have healthy discussions. And most importantly, if you need the best OET coaching, call us on +917696734256. For the people who are in India, OET coaching number is 76967342256. So I'm just going to take you to the task. OET speaking, writing, otherwise reading and listening also. But still, if you have studied from Hindi medium, Punjabi medium, or maybe if you are speaking Malayali or any other language, I'm sorry, I don't know about much regional languages. So I'm just giving an example. So if you're from your own particular region, you have studied in your own mother tongue language, then the only problem that happens in reading and listening. But these are also not impossible. These will also happen. But the easiest thing that can happen is writing followed by speaking. So these two modules can be done very easily. What you need to do, suppose if I am talking to you right now. So what you need to do, you just need to speak after me. So have your headphones around your ears and then speak the way I speak and keep on doing one speaking 5 times. You will see yourself improving because when you will repeat after me, you will learn my accent, you will learn how to speak, and that is how you improve. So in this task, if I say you are a head nurse, you are attending on a patient who has undergone an operation for the thyroid gland removal. The patient is unable to speak properly and she has difficulty in swallowing or even breathing properly. Begin with the warm greetings, warm and friendly greetings. ये तो वैसे भी होगा अगर आपके पास patient होगा. Good morning, my name is this, I am your nurse for the day. So as I can see from your notes, Mr. John, that you have undergone thyroid gland removal. So I would like to ask you, how are you feeling now? So that is how you start the task. Good morning. My name is Dr. BKM. I am your nurse for the day. Sorry, Dr. BKM से doctor हटा देते हैं. Good morning. This is BKM. I am your nurse for the day. So I can see from your case notes that you have undergone operation for thyroid gland removal. Mr. John, am I right? Yes, nurse, but I'm not really happy. His voice would be very low. That is where you need to maintain your confidence and your voice. क्योंकि patient का तो operation हुआ है, patient has undergone operation. He will not be able to speak that loud, but you have to keep your professional tone. Speaking tone is the most important thing when it comes to OET. So you say, okay, don't worry, I am here to help you. So could you please tell me what is bothering you? Well, nurse, I am having many problems. Speaking, swallowing, breathing, there's so many problems going on and I'm really worried about it. So as you know, your task is smaller. So that is where you need to carry this task with your own energy. Examiner might not speak at all. I was reading one of the compliments from the YouTube follower that, sir, my speaking person interlocutor spoke everything in one line and then he did not speak anything. So that is where I am saying coaching is so very important because we tell you to practice your task yourself for 5 minutes. आप कहते हो सर हमारे साथ कोई बात करने वाला नहीं है, कोई बोलने वाला नहीं है, there is nobody to speak to me, how should I practice? That is the best way of practice. अगर आपके पास कोई नहीं है, record your task, then listen to your task. आपको अपनी गलतियां पता लगेंगी. Then again record your task, again listen to your task. Do it 5 times, every speaking. You will see that within a week, you will become a pro. Pro means professional. You will become really good. Trust me. Record, speak. Record, listen. You will find your mistake, then again record, then again listen. Then again record, again listen. You will see your improvement happening. 5th time जब आप बोलोगे ना, आपको अपनी रिकॉर्डिंग सुन के प्राउड होगा, प्राउड. दैट इज इतना सिंपल है. लेकिन जब आप एक टास्क करते हो, टीचर के साथ 5 मिनट बोलते हो, यू स्पीक टू टीचर फॉर 5 मिनट्स, देन यू लीव इट, देन यू गो टू अदर डे, नेक्स्ट डे यू विल हैव अनदर टास्क. That is why I'm saying do only 3 modules a day, but do 2 to 3 times at least. That is the best way to improve. So in this case, when examiners is speaking all the task in one shot, then you have to carry this task for minutes. So you say, these satisfactory points are very important. Okay, Mr. John, I am understanding what you are saying. I have seen your notes, as I have already mentioned that you have undergone thyroid gland removal. So I would like to tell you there are some problems which are bound to happen after this kind of an operation. As you know, thyroid gland removal is not a small thing. So obviously there will be some kind of side effects, but you would be glad to know these side effects are very temporary and they will soon wean off. Let me tell you about your speaking first. As you have told me that you have not been able to speak, so I would like to tell you that you would be able to speak in much better way after 2 to 3 weeks. Right now, you should not try to speak anything because this will put pressure on your vocal cords. And especially by speaking continuously, it can have a negative effect as well. So I would really encourage you not to speak anything for a while, especially for the first 2 3 weeks. You speak only to the point and also for the requirement. So please don't try to have gossips with anybody, especially in the first 2 3 weeks. But nurse, I am a lecturer, I need to give the lecture. See, as doctor would have told you prior to the operation as well, that you need complete rest at least for 2 weeks. So please do not take any lectures, and especially in the loud voice, it can harm you. And also it can be it can be threatening for you. So please understand you are not supposed to do anything like that. थ्रेटनिंग वर्ड थोड़ा ज्यादा है, ऐसे वर्ड्स को यूज नहीं करना चाहिए, मैंने गलती से यूज किया. सो इट वुड बी हार्मफुल फॉर यू, सो प्लीज डोंट डू दैट. आर यू, फिर उससे पेशेंट से पूछो, आर यू अंडरस्टैंडिंग माई पॉइंट, इस चीज के पॉइंट्स हैं. सो हैव यू अंडरस्टूड? ओके. सो सेकंड थिंग इज regarding the swallowing. So doctor has put you on liquid diet. So in the first 2 weeks you can only have liquid diet. For now you are having this IV fluids. Once the IV fluids will be removed, then you can take it orally. And in the initial stages, as I have just told you, that in the first 2 weeks you have only liquid diet or the blend diet. So here is the leaflet. It contains all the information regarding the diet you need to follow. If you have any doubt, I will also fix your appointment with the dietitian. He will explain you everything about the diet as well. Third important thing is that the breathing problem will also be fine. It is just kind of a minor side effect that does happen. So your breathing would be all normal after a while. Within like 2 3 days, you will feel everything normal in terms of breathing. So are you getting my point? Is it comprehensive? All right then. Okay, so I would like to repeat all the things which I have mentioned, that all your problems will fade away or will go away within like 2 3 weeks. It's just the matter of 2 3 weeks patience. Also, I would like to suggest you that you need to elevate your head all the times for the first 4 to 5 days after the surgery, even while sleeping. So please make sure that you do not remove the pillow underneath your head. It is very important for the first 4 to 5 days. Okay, so I'm giving you a leaflet which contains all the information apart from the diet. It contains the information about speaking and other problems as well. And I assure you that there is nothing to worry. Your operation has been successful. These are the minor side effects which usually happen after the thyroid gland removal. So there is nothing to worry about it. So do you have any doubt? Should I repeat anything for you? No, nurse. Okay, then take care. Now have rest and I am leaving. Also, there is a buzzer on your bedside. Please ring the buzzer if you need anything. Is it all right? Okay, take care. Mr. John, that's the way you speak your task in a very nice and a polite way. छोटी मोटी गलती जैसे मैंने आपको कहा कि थ्रेटनिंग वर्ड मेरे मुंह से निकल गया, बट इट डजंट मीन कि आपको अब उस वर्ड पे फोकस करते रहना है, तो उसको दोबारा रिपीट करो. व्हाट आई मीन बाय दिस स्टेटमेंट इज दैट इट कैन बी हार्मफुल. So please try to understand, not to pressurize your vocal cords, and everything will be fine. So please try to make sure that you speak it very well and in a very nice way. This is Dr. Bhupesh from Dr. BKM Institutes. Again, our contact number is 76967342256. Thank you.